And I'd like you to welcome our first keynote speaker, Dr. Amish Purohit. Our first keynote speaker this evening is a transformative voice in modern healthcare, a leader who spent over 2 decades redefining how communities experience care, dignity, and accessibility. A physician executive with deep expertise in value-based care and large-scale health transformation, he blends clinical insights with strategic innovation to shape the future of care delivery. And as co-founder, president, and chief health officer at Arkos Health, he continues to champion healthcare that is compassionate, equitable, and forward-thinking. Please welcome Dr. Amish to the stage.
Sorry, I can't stand behind a podium and talk, something I'm not used to. But first of all, I just want to say it's such a privilege and honor to be here with all of you inspiring healthcare leaders, change makers, and advocates. I'm Dr. Amish Purohit. I'm the co-founder, president, and chief health officer of Arkos Health. And in my 20 to 30 plus years of healthcare experience, I've had the opportunity to practice medicine, but not only practice medicine, but I've been striving to transform it. So when I look at my experiences in healthcare, one of the things that is near and dear to my heart is healthcare equity. And in the United States, when we look at CMS, which is the largest payer government entity body, they had 3 initial aims. One was reducing per capita cost, okay? The second was, how do we improve the health of a population? And the third was, how do we improve patient experience, okay? Those were the 3 priorities, but equity was nowhere to be seen, okay? Then they said, well, listen, we have a 4th aim in the United States, and that was to increase provider satisfaction. Our clinicians, our doctors, our nurses were burning out because of all the burden that was being placed on them. And so that became the 4th aim. Then someone in government decided, well, guess what? We should think about health equity. And that's what I want to talk to you about tonight, okay? It's not about metrics, it's not about margins, it's not about models of care. It's about how do we bridge the gap in healthcare equity in global healthcare delivery. Okay? You look around the room and you look at each other, and if you ask yourself, do I have any issues in getting health care? Probably not. But if I ask you, in your own healthcare experience in terms of delivery, how many of you have had experienced challenges? Even I, as a doctor, if I have to use healthcare systems in the United States, I get frustrated, okay? And I have friends in the clinical space. But it's hard for me as well to get health care. And so think about those that don't have the connections, that don't have those relationships, don't have the education. What about them, okay? And so the World Health Organization came out and they said that 50% of our global citizens lack the essential healthcare services. Think about that, 50%, okay? Which means that 50% of that population does not have access to good, high-quality health care, okay? Now, even in the United States, I was talking to someone earlier, oh, the healthcare system must be great in the United States. No, okay? Even in the United States, life expectancy, the determination of life expectancy is more related to the zip code that you live in, not your genetic code. What does that mean? If I live in a posh area, I'm going to live longer, but I live in a very dilapidated government housing community, I'm going to live a lot shorter. Is that just? Is that right? Okay. We have made tremendous amounts of strides throughout the globe when it comes to technology. Okay. We have gone from developing new treatments for cancer. We heard from one of the doctors that's doing cancer research, immunotherapy. We have powerful tools now in terms of analytics and predictive analytics in population health. However, despite those advances, we still can't deliver equitable health care throughout the globe. Okay? So this isn't just a failure of infrastructure. It's a failure of intent. It's a failure of design. And it's a failure of delivery. Let's see if we can go to the next slide. So, in my career, I have witnessed plenty of populations and vulnerable populations and seniors that have struggled to get health care. And they've fallen through the cracks because of a fragmented healthcare system. Okay? I have seen doctors that are frustrated with their healthcare system, not because they don't have the knowledge to provide the care to their patients, but they lack the tools. They lack the ability to use tools to improve outcomes of their patients. Okay? In the United States and in every governmental run healthcare system, there is bureaucracy, there's burden, there's documentation, and that takes away from patient care. So why is it that we haven't progressed? Why is it that we can't deliver equitable health care? Okay, now I'll tell you a story. You're probably looking up here and saying, oh yeah, I've heard this story. This is a story about a 32-year-old female in an African village whose child had pneumonia. She had to walk 5 miles to go to a clinic. She gets to the clinic and guess what? No more antibiotics. So how does the story end? Most people, well, the child gets sicker, the child dies. In this case, that's not what happened. In this case, that community was resilient. That community pooled resources to get that child to the next closest hospital to get treatment. That was 3 hours away. And if you think this is something that doesn't happen on a daily basis around the globe, it does, okay? We've got refugees around the world that are not getting the health care that they need. And so in this case, it was a success, but not because the system worked. It wasn't because the system worked. It was because of the community, the resilience, and the people in the community that made it happen. So, what are the barriers in our healthcare system? And I can say that this is an issue across the globe. If one of you in the audience raise your hand and say, this is not a problem where you come from, I would say that you're misinformed, okay? So first, fragmentation in healthcare. There's fragmentation between people that pay for healthcare, people that are receiving healthcare, and people that are providing healthcare, okay? How many of you, and I don't know where you all are from, but I tell you in the United States, we have electronic health records. People document everything in the electronic health records. But we have hundreds of them, but they don't communicate with each other. And because they don't communicate with each other, if a patient goes to one hospital, to another hospital, to a third hospital, it leads to duplication of services and tests that they probably don't need again and again. But guess what happens? It leads to poor outcomes, okay? The other problem is economic disparity. So what does that mean, economic disparity? Should healthcare be tied to employment and where you live? Or should it be a right for every global citizen to have health care and basic health care? We're not talking about advanced treatments, but basic health care. That's the other issue. Look, we're in 2025. There's a thing called the digital divide. We are promoting technology in healthcare, but we forget that there are millions and millions of individuals out there that don't have broadband, that don't have devices. How do you reach them? It's great to have artificial intelligence. It's great to have telehealth. And it has helped in rural areas. But there's still a significant portion of our population that doesn't have access to digital devices or the digital literacy. Now, one of the biggest things, and I know a lot of you that work in healthcare, a lot of you that are healthcare providers, you scratch your head and you're like, where are these strategies coming from? How are we building our infrastructure? And it's cultural disconnects. Where do you think, when these big hospitals put their hospitals together, they look at their operational workflows? How is that being put together? In the boardroom, okay? It's in the boardroom. Well, that doesn't translate to our communities and how people would like to receive health care. If you look at health care, we provide care when it's convenient to the system, not when it's convenient to the patient, okay? So these are the things that we've got to fix. Now, the real gap in access, okay? The gap isn't just in access, it's in alignment. We're not aligned when it comes to innovation and implementation, and I guarantee you, I get a call every single day from someone trying to sell me a technology that I don't need. A technology that says, well, yes, we can improve outcomes. You pilot it, and it fails, okay? It's not aligned. Knowledge and compassion. We have the knowledge, but do we have the compassion? And then technology and trust. How many of you out there actually trust the technology that's out there? And if you're a practicing provider, ask your patient the next time, do they trust the technology? And a lot of them will tell you, I don't know. And especially if it's sensitive information that you have to load into an application, do you want your information, especially when we have all these data leaks, data hacks, do you want your medical information on the web? Probably not. So we do have to get better in terms of security. Okay. So the good news is we know what works. And at Arkos Health, we have built a physician-led, tech-enabled ecosystem that helps our populations, okay? And when I say an ecosystem, not only are we providing healthcare in the home, but we're providing care coordination, wraparound services. We're using analytics to identify those patients that are of the most need, and we're also focused on looking at interventions that actually have an impact, okay? I'm sure you've heard the term care management. Care management is a broad term. Everybody has care plans, and we'll say, okay, you're a diabetic, this is what we're going to do. Well, it's great. I'm going to give you medicine for diabetes. I'll give you metformin. But what about if you can't take it? What about if you have side effects? What about if you can't get to the pharmacy to get the medicine? It's not going to help you, okay? So we have the blueprints in terms of how to make things work, and it has to be focused on the patient. So what we're seeing now is in communities that are really their intent really is to improve the health of their community, we're hiring community health workers, and it's happening globally, okay? We're hiring people from the community to help the community navigate a complicated healthcare system. There are public-private partnerships that are occurring between private companies and the government to improve health in indigenous and underserved communities. So when I look at some of the results, and this is not a pitch for Arkos Health, even though we're looking at some places globally, but because of our ecosystem and our services, We have reduced emergency room visits by 40%. We've increased medication adherence by 65%, okay? That's not insignificant. I put cost on the bottom because yes, cost you've got to look at, and there was a Catholic nurse years ago that said, no margin, no mission. So I get it. We're in business. We have to sustain a certain level of margin. And we also help our payer partners reduce the cost. Okay. So, what is equity? This is where people get confused. What is equity? Is equality and equity the same thing? It's not. Equity is not giving everybody the same thing. Okay? Equity is giving the individuals the tools, the resources they need to be well. And it's individualized. Not every single individual has the same needs. And at Arkos Health, that's what we do. We try to identify what does this individual need, what does this family need to get the best access to health care and the best care possible. So don't confuse equality and equity. And I will tell you that equality, access to health care is there, but not everybody can get it. Okay? We talk about the story of Amina, who walked 5 miles, who didn't have transportation. The equity component of that story would be getting her the transportation to the clinic rather than her having to walk 5 miles. Okay? So, and behind every story that you hear, okay, or behind every statistic, there is a story. Okay, a diabetic grandmother without transportation, a refugee child navigating trauma, okay, caregiver, and we see this, caregivers are burdened in our healthcare system when they're working 2 jobs and they're trying to take care of a loved one. Maybe that's on dialysis. And for a lot of you, I'm sure you've experienced, if you have elderly parents that are sick, you have a full-time job, you have kids that you're trying to raise at the same time. How do you manage that? Who's going to help you when there's caregiver burnout? Okay? So healthcare equity isn't charity, it's justice. So, how do we move forward? This is my favorite part. Okay? We need to redesign our systems around patients. Patient-centric care. Raise your hand if you've heard about patient-centric care. Nobody? Some of you? Now if I asked you, what is patient-centric care? Can you give me a definition? If I asked every single one of you separately, you would have a different definition of what patient-centric care means. And the reason why we haven't reached or met the goal of patient centricity is we ourselves don't have a clear definition of it. So first, we need to define what that means. And then we need to build those models around those patients. How many times, if you look at your healthcare systems, have they come to you and asked you what you want out of their system? Okay? Sure, they send patient surveys in terms of satisfaction. But if they're building a new cancer wing or they're building a new clinic, how many times have they come to you and said, what would you like to see? Has anyone in this room or here on the beach tonight been asked that question? Because if we're not asking the questions to the people that use the system, we're building the wrong system. We need to ask the individuals that are using it. Just like in technology, who's the technology for? The end user. If the end user can't use the technology, it's useless. Okay? We need to invest in prevention, in primary care, and especially in underserved rural areas. I talk about technology. We need to embrace technology, but responsibly. Okay? We have to ensure that the digital tools that we create don't widen the digital divide. And finally, we need to lead with empathy. We need to prioritize compassion. Have you ever heard anyone tell you, let's prioritize patient care over profits? Well, that's what we should be doing, but we don't, okay? And as a coming from a country that's capitalistic, coming from a for-profit business, I'm telling you, our hearts are not in the right place. We need to change how we think, and I will guarantee you, if we put patients and their families first, the profits will follow. Okay, so in closing, I want to make sure that you understand we're just not stewards of innovation in terms of healthcare leaders. We are custodians of hope. And tonight, I pray that hope reaches every heart, every village, every community. Okay? And healthcare equity, let equity be the heartbeat of healthcare, and let compassion be its currency. Thank you very much.